Welcome back. Let's get you an update from Kerala, where the Nipah virus outbreak has been reported and the fifth case has been recorded by the state. The total number of cases have now risen to 5. We're given to understand that 770 people are on the contact list. And given the situation in Kerala, now Karnataka has put some hospitals on high alert. These cases are being detected in Mangaluru. And to talk more about the situation there, we in fact are joined by Dr. Anoop Kumar. Thank you very much, Dr. Anoop Kumar, for joining us on the broadcast. Can you help us understand how exactly, these cases were detected? How were you able to diagnose the Nipah infection in Kerala?
This time, actually, we had a death in outside hospital on 30th of last month. So that patient was presented with features of bronchopneumonia, later developed multi-organ failure, severe hypoxia, that means low level of oxygen. Then he succumbed to the illness. Later, from his family, almost 10 days after, they presented to the hospital where I am working, that is Aster Mims Calicut, with a history of fever, dry cough. So initially one patient was dying, then almost after 10 days, 4 members from the same family were getting admitted. So that made us to think about something like an infectious disease spreading from one person to the other. So at that time, when we were evaluating the symptomatology, the one child who was admitted with fever and features of pneumonia, breathing difficulty, the child developed seizures. At the same time, when we were taking the history about the patient who died, so they were saying that the patient was having slurring of speech, diplopia, etc. during the time of presentation. And again, these all patients were coming from an area which is very near to the epicenter where the Nipah outbreak was reported in 2018. So taking all these points together, like clustering of cases, one index case dying 2 weeks, almost 2 weeks before, coming from that nearby that epicenter, and some unusual clinical features there in the usual pneumonia. So these features made us to think about the possibility of Nipah, and we immediately isolated all these patients, taken all precautions, and we have sent the samples to NIV Pune immediately. At the same time, we have informed that there is a likely Nipah cases in our hospital to the health minister and higher authorities in the health department. So they, at the same point itself, they have also started all preventive measures. They have even started doing the contact tracing, isolating all the contacts, and again looking for symptoms in the contacts, and again asking for the quarantine for all exposed persons. And the main difference this time we observed than the outbreak in 2018 was, in 2018 and all the previous outbreaks of Nipah reported in different parts of the world, it was mainly the encephalitis symptoms, like the patients will be presenting with fever, later on progressing to altered sensorium, some abnormal behavior, seizures, etc. But this time the patients are all presenting with fever and respiratory symptoms, or the so-called flu-like symptoms.
Right. After Dr. Kumar, a few unusual fever deaths were reported. You played a key role in detecting the Nipah virus in Kozhikode. Now, talking about the two variants, is there a difference in symptoms that we are witnessing today in comparison to what happened 5 years ago?
Yeah, that is what I already mentioned. In 2018 outbreak, the symptoms were mainly the encephalitis symptoms along with some respiratory symptoms. But this time it was predominantly the respiratory symptoms. That is the main difference. So definitely there may be some the mutation happening, or maybe a new variant of the virus. Usually the Nipah virus are having two variants, which is described already. One Malaysian variant where there is no human-to-human spread, and one Bangladeshi strain or Bangladesh strain where there is a human-to-human spread. And in previous outbreaks, the strain was the Bangladesh strain. So this time also it is likely that it is a Bangladesh strain, as there is a human-to-human spread. But there may be some slight variation in the there may be some slight genetic mutation happening.
Well, of course, precautions need to be taken now to assure minimum infections. 5 cases have been reported in Kerala and 770 are on the contact list. Dr. Kumar, thank you very much for joining us. Thank you for speaking to us on this issue. With that, we're slipping into a very short break on this broadcast. News and updates will continue. Stay on with us.